Well, I hope, Mr. McGinty, you will consider going back to the table, but this time take with you some of the people who have expertise. Take the doctors, take the medical people, take some of these nurses around here who are doing a fantastic job. I mean, I wouldn't probably be sitting here talking to you if it wasn't for them.
He needs to get a reality check. And I mean that one. Because something is wrong here in this whole program. Why is he cutting it apart?
Well, you can cut dollars and look for a politically motivated short-term gain, but you're going to get long-term pain.
I don't doubt that he's going to save billions of dollars, but he's got to pick some other places.
Because they don't have boots on the ground experience of their own, they tend to be bean counters at heart. And when they're just looking at the bottom line, bean counters tend to count beans and not the after effects of what a loss of those beans here or there might be down the road.
It's very obvious that they should be more open, but I don't know how you get them that way. Maybe another election.
If I could talk to Mr. McGinty, tell him to get real. It's just too much running around, going from this office to that office and then having to go back to your doctor for the tests that you're having done be evaluated. I don't want to do it. I don't see why I have to.
I don't agree with what they're doing with these testing fees. I think it's absolutely stupid, because what is the point in us having a cath lab, being able to do angioplasties, and having to go to Coburg, Lindsay, Kingston, someplace else to have a test done that you'd have to have done before you proceeded to that? That it doesn't make sense.
To me, we're being penny wise and pound foolish, or dollar foolish, because someone will run an EKG or an echocardiogram and they'll still have to send it to Dr. Swan to read, and then I would have to come in and talk to Dr. Swan, whereas right now it's a one-stop shop for me.
You know, Mr. McGinty, I work for myself. I'm self-employed, and if I need to take 4 days off work to go to the pediatrician to get a referral to the cardiologist, who then has to refer me to the hospital, who then takes me back to the that's 4 days of pay that my family is doing without.
Cardiologists and doctors, they should have enough support from you and funds from you to have their own equipment to see patients and do assessments right away.
When my brother or sister or friend has a heart attack, has the experience I had, they're not going to have the benefits that I had. I mean, I'm grateful and I'm thankful, but I feel bad if somebody else is going to be denied that. I think they have a right to that.
Well, my worry, if you know, the funding changes so that he can't afford to have the equipment in his office to do these kinds of tests, there will be all kinds of families out there that won't have the wonderful experience at a time that can be quite devastating for families.
I just about died, actually, and if it wasn't for his office and the 3D and everything else, and I think this is ridiculous what you're doing or trying to do, and I don't really approve of it at all, and I don't think a lot of people do. So, you know, you've got to stop.
Dalton McGinty, it's time you looked after Ontario citizens. Our wait time is atrocious right now, and it's only going to get a lot worse. How many patients are going to die waiting for a heart transplant? And as far as I'm concerned, if it happens, then all the blame should come back to you.
I guess I would just have to rely on, I have a good family doctor. He's not a cardiologist. He would just, I guess I would just have to go to a hospital and hope there was somebody there that could take care of me.
There are lots of other ways you can save money other than people's health, because people like me who come to Dr. Swan all have a pre-existing condition. We're not coming here just for a test, you know, to run a test to make sure that your heart is functioning. It's already known that I have a heart condition, and when I come here, I just come to ensure that it's okay. And truthfully, I have a granddaughter, 4 months old, who unfortunately has a heart condition, and I hope that she has access to the same level of care that I did.